So usually flat feet, they're not out of the blue. I think people often, for various genetic reasons or inherited from their family, you can have a slightly flatter foot throughout your life. And many people do. Up to about 20% of people in the UK will have flat feet to some degree. But despite that, we don't really know what causes it. But we think that for some reason, especially in the flat feet which have problems, the muscles and tendons and ligaments which support the arch of your foot, they get a bit weaker. And one of them in particular, called the spring ligament, can get weaker. And once that happens, the deformity gets weaker. And then eventually your muscles can't take up the slack and they get weaker. And the flat foot gets worse and worse. But some patients do have what we call an acute flat foot, which happens all of a sudden. So, for example, if they've had an injury or a sprain to their ankle, which tears these structures. So that's a very common question we get asked. And I think it depends again on where the pain is. So if you have pain on the inside of your ankle, then that can often be related to one of the tendons which supports the arch of your foot. If you have pain on the outside in a specific place below your ankle or below the knobble of bone on the outside of your ankle, then that can be if you have a severe deformity that one bit of bone is rubbing against the other. As for knee pain, if you feel your foot's rolling quite a bit when you walk, then you can sometimes get pain on the inside. And one of the ways we often try and test this is we can get a little insole to support the arch of the foot. And if that improves the knee pain, then it's likely the knee pain is being caused by the foot. Flat feet aren't a problem in itself. There are a lot of famous people who have flat feet, like Usain Bolt. And it's okay to have a flat foot, but it's not usually okay to have a flat foot that's getting worse and causing you more pain. That being said, there is a combination of things which most people need. So you need to sort of build yourself from the ground up so that you don't have a deformity. And that's an orthotic or an insole, which gives you a support of your arch, and you wear the right type of shoes, especially if you do things like running, which are designed for people who overpronate. So that supports the arch of your foot. And then you have physiotherapy. And one of the main things is people get a tight Achilles tendon or a tight calf muscle, which can cause the deformity to get worse. So you focus on stretching that. And you focus on building up the muscles, such as the tibialis posterior muscle, which supports the arch of the foot. Those are the main ways in which we treat these non-operative. So there are many operations described depending on how bad the flat foot is and how flexible it is. But broadly nowadays, we think about it on how stiff or flexible it is. And we can use various things we look at on an X-ray or CT to help us determine if there's any arthritis or what the exact nature of deformity is. And the various classification systems which guide us. But in general, if it's flexible, we try and realign the bones and realign some of the soft tissues to try and give you structure back. But if it's stiff and it's got arthritis, then we may need to join the bones together to try and correct the deformity. And that's called a fusion. I think anyone can be suitable for surgery, but it's always best to try non-operative treatment first, because if that works, then great, you avoid an operation. And there's certain factors we can try and optimize. So people who are diabetic need to have the diabetes under control. People who are smoking should stop smoking. People who are very overweight should try and lose weight first, because all of these increase the complication rates of surgery. And so these are things that you can optimize. So once a flat foot starts becoming a problem, and once the deformity starts becoming worse, it's only going to go one way. It's only going to get worse. A little bit like the Leaning Tower of Pizza. Once it starts going, it's a slow, inevitable progression, and the body can't right itself. What you really need to do is things we've talked about already, which is supporting with some external device, such as an orthotic, to support the arch, to get the foot and the heel in a better position so that the muscles can work more effectively, and then start doing some physiotherapy to strengthen the muscle. Some of this will be needed for the short term, and some of it might be needed lifelong. Most of the time, people can get by without surgery. And if you do it and you're regular with your insoles and your physio, people can get by many, many years with very few symptoms. But if it becomes stiff, painful, or any of these non-operative measures stops working, then you may need surgery.